All right, so we're going to talk next about anemias in general. The definition of anemia is a decrease in red blood cells or in hemoglobin concentration. So anemia is there's not enough hemoglobin or red blood cells to carry oxygen. Anemias are classified by cause. Why are they anemic? And by morphology, which is the size, shape, and color of those red blood cells. There are three basic causes of anemia. We're not producing enough, we're losing too many, or we're destroying too many, okay? Decreased production of red blood cells can be due to nutritional deficiency, and it can also involve decrease, especially for iron deficiency, that can mean decreased quality of those red blood cells, which would mean the hemoglobin concentration decreases. Decreased production can also happen because of bone marrow failure. So if we're not producing, it's because we're not taking in what we need to produce red blood cells, or because the bone marrow that produces blood cells stops working or is not working enough. Increased loss of red blood cells can be from acute or chronic blood loss. Okay, we can have an acute bleed that's very obvious, or we can have a slow chronic bleed. Increased destruction of red blood cells can be either intracorpuscular, meaning that something wrong with the cells is causing them to be destroyed, or extracorpuscular, which is something outside the cells is causing increased destruction. Either way, we are anemic because we don't make enough red blood cells, we lose too many red blood cells, or we break down too many red blood cells, okay? Think about those three things. So what are the consequences of anemia? If we don't have enough red blood cells, or our red blood cells don't have enough hemoglobin, we have decreased oxygen carrying capacity. And I want you to pause the video for just a minute and make a list of what you think that's going to look like in your patient. What is it going to look like if they cannot carry as much oxygen? So they're going to be they may be pale, they're going to be fatigued, shorter breath, tachycardia and tachypnea. If they don't have enough blood cells to carry the oxygen, their heart's going to have to work harder, and their lungs are going to have to work harder to try to get more oxygen in. If it's severe and chronic, in children, it can restrict their growth and delay sexual maturation. Okay. It also, we can't carry enough oxygen, but also we have decreased blood viscosity because red blood cells are responsible for a lot of this viscosity of blood. So that means the blood is watery. Okay, instead of thick, it's more watery. So it returns to the heart more quickly. That you can actually hear a murmur in some patients who have moderate to severe anemia. Severe anemia can lead to heart failure because the blood just is too watery and it goes through too quickly for the heart to handle. Okay, so two consequences of anemia: decreased ability to carry oxygen and decreased blood viscosity that can lead to CHF. It is diagnosed by CDC. And then once it's determined the patient is anemic, then the CBC, as well as history and other testing, is used to determine what's the cause of that anemia. Symptoms may cause someone to go to the doctor and they do a CBC and discover anemia, or it may be discovered on routine labs. The symptoms can also help with diagnosing what specific type of anemia is happening. Management of anemia. The provider management is going to be focused on reversing the cause. So whatever the cause of that anemia is, can it be fixed? And then the first line is to promote natural replacement of hemoglobin and red blood cells. So we want to make sure they're getting adequate iron intake, give them the opportunity to make their own. If anemia is severe, they may need oxygen supplementation and rest, and they may need volume expanders to expand the blood volume, especially if it's due to blood loss. And if it's severe enough, then we can transfuse those red blood cells. Okay, in the next section, we'll start talking about specific types of anemia. The next section is going to be iron deficiency.